And then we can see the progression of the tongue, which I don't have the full spectrum of it, but you can see very wide coating, okay, and what teeth mark. With teeth mark is Qi deficiency, and then the white coating is dampness and phlegm. This is the tongue that actually I get it from my clinic and on Saturdays. There's a couple patients that are presented with no fever, but dry cough and fatigue. Okay, and of course they were not coming to the clinics to see the symptoms, but they actually start showing the tongue with white coating. So and then this is one, and this is another one. Okay, the tongue wasn't look like this before, and then it starts showing this kind of presentations in the clinic. So. And then on top of that, we can actually add some treatments, that acupuncture points that help to remove the dampness for the body. And later, we're going to also talk about this and what points you should use for patients presented with this tongue in our clinic. Okay, so there's actually already 4 versions of a government guidelines that's being published in China. Inside the guideline protocols, including the traditional Chinese medicine and the herbal distributions to the patients who are in 5 different stages. So I decided to use the one that published in Zhejiang, because in Zhejiang province, they actually consider, they also consider and take a look at the government guidelines, and together with the modifications of the local Zhejiang province weather. Okay, of course, in U.S. we have our own. We also have our own, weather characteristic. So I don't want to give you the formula and not having modifications. So all the practitioners in U.S. we should modify according to the weather, and in our local area, to further helping the patient to alleviate their symptoms. So look at this report that coming from the Johns Hopkins, Zhejiang, mainland China's. The reason why I choose this, I was looking at the data. This confirmed cases is 1,206, and look at their recovery rate, 1,069. So it's about 88% of recovery, and then existing only 136 cases left, and only 1 death is reported. So, and then the involvement of traditional Chinese medicine is 90% above. So. That's why I decided to use the Zhejiang one, and then I'm going to introduce from this is they're called red head documents that being releases. So every hospital that receiving patients will have to use this protocol. First of all, they actually separate into diseases. In 5 stages. The first actually is prevention. Okay. And the prevention is actually in the philosophy of traditional Chinese medicines, means we actually take before the attacks, or prevent before it happens, right? Then what the recommendations from this particular guideline is they use 玉屏风散. Okay. 玉屏风散, look at this formula. We have 黄芪 to tonify the qi. Remember that the patients actually present with severe fatigue and also may not present with fever. And then patients actually have dry cough. Means a shortness of breath. It's all like a qi deficiency. So patients we are already embedded with qi deficiency are not having enough sleep, which is very common in the Silicon Valley. They will have a higher risk to get, contaminated with the coronavirus. So for this, we actually need to prevent before it happens. So you have 防风, right, to prevent the wind or to expel the wind attack. And we also have 白术 inside the 玉屏风散. So 白术 is also strengthen the digestion system, because many patients with the coronavirus, COVID-19, the symptoms is sometimes they have low appetite and also have diarrhea. Okay, and then